Your head is starting to have a mild ache and you're waking up frequently throughout the night. Have you ever considered that these disturbances could be signs of a brain tumor? This thought probably never crossed your mind, but recognizing the symptoms of this serious health condition can be crucial. Today, we'll cover the subtle yet significant signs of a brain tumor that commonly appear at night. These nocturnal symptoms can reveal important clues about underlying health issues. Let us know in the comments if you're experiencing any of the following symptoms. At the end, we will discuss some environmental toxins that may contribute to the development of brain tumors and how to avoid them. Number 1. Headaches. Headaches that occur or intensify at night can be a concerning sign, especially when they are related to a brain tumor. These headaches often present as persistent, dull or throbbing pain that can become more severe as the night progresses. Individuals might wake up during the night or early in the morning with a headache that feels particularly intense, sometimes described as a pressure that builds up inside the head. The underlying cause of these nighttime headaches in the context of a brain tumor is usually due to increased intracranial pressure. As the tumor grows, it can obstruct the flow of cerebrospinal fluid or directly compress brain tissues, leading to a buildup of pressure within the skull. This pressure can be more pronounced when lying down, as the horizontal position can affect fluid dynamics and exacerbate symptoms. Additionally, the body's natural variations in hormone levels and blood pressure during sleep can contribute to these nighttime headaches. Number 2. Seizures. Seizures occurring at night can be a distressing sign, especially when they are associated with a brain tumor. These nighttime seizures might involve convulsions, sudden jerking movements, or episodes where the person becomes unresponsive or experiences a sudden loss of muscle tone. They may wake up feeling confused, disoriented, or with no memory of the event. This can be particularly frightening both for the person experiencing the seizure and for anyone who witnesses it. The occurrence of nighttime seizures in individuals with a brain tumor is typically due to the tumor's effect on the brain's electrical activity. A brain tumor can cause abnormal electrical discharges by irritating or compressing brain tissue, disrupting normal neuronal function. This disruption can lower the brain's seizure threshold, making it more susceptible to spontaneous electrical activity that results in seizures. The brain's activity during sleep, particularly during certain stages, might also trigger these events. Number 3. Nausea and vomiting. Nausea and vomiting that occur at night can be alarming, especially when they are linked to a brain tumor. This experience often involves a persistent feeling of queasiness or an urge to vomit that disrupts sleep, sometimes leading to sudden episodes of vomiting that seem unprovoked. Waking up with nausea or vomiting, particularly when it happens consistently, can significantly impact one's quality of life and overall well-being. The primary cause of these nighttime symptoms in the context of a brain tumor is usually related to increased intracranial pressure. As the tumor grows, it can obstruct the flow of cerebrospinal fluid or compress surrounding brain tissues, resulting in a buildup of pressure within the skull. This increased pressure can stimulate the brain's vomiting center, leading to feelings of nausea and subsequent vomiting. These symptoms may be more pronounced at night or upon waking, as lying down can exacerbate the effects of intracranial pressure. Number 4. Sleep disturbances. Before we cover this next symptom, don't forget to like and subscribe. Sleep disturbances can be an unsettling sign, particularly when they are linked to a brain tumor. These disturbances might manifest as difficulty falling asleep, frequent awakenings throughout the night, or an inability to stay asleep. Individuals may experience restless nights, waking up feeling unrefreshed or exhausted despite spending sufficient time in bed. These sleep problems can significantly impact daily functioning, mood, and overall quality of life. The presence of a brain tumor can disrupt sleep patterns in several ways. Increased intracranial pressure caused by the tumor's growth can lead to discomfort or pain that makes it hard to stay asleep. The tumor may also directly affect areas of the brain involved in regulating sleep, causing disruptions in the natural sleep-wake cycle. Additionally, symptoms such as headaches, nausea, or seizures, which are more pronounced at night, can contribute to frequent awakenings and poor sleep quality. Number 5. Vision changes. Vision changes that occur or become more noticeable at night can be a troubling sign, particularly when associated with a brain tumor. These changes might include blurred or double vision, difficulty focusing, or the appearance of unusual visual phenomena such as flashes of light or blind spots. In the dim lighting of the night, these symptoms can become more pronounced, making it harder to see clearly or navigate in low-light conditions. The presence of a brain tumor can impact vision in various ways. A tumor located near the optic nerves, optic chiasm, or visual pathways in the brain can exert pressure on these structures, disrupting normal visual processing. Additionally, increased intracranial pressure caused by the tumor can lead to swelling and further compression of the optic nerves, exacerbating vision problems. These effects may be more noticeable at night due to the lower levels of ambient light, which can make subtle visual disturbances more apparent. Number 6. Brain fog. Brain fog, a condition characterized by confusion and a lack of focus and mental clarity, can be particularly troubling when it manifests at night and may be an indication of a brain tumor. Individuals experiencing nighttime brain fog might find themselves struggling to think clearly or organize their thoughts, which can lead to frustration and anxiety, especially when trying to wind down or sleep. The underlying cause of brain fog in the context of a brain tumor often involves increased intracranial pressure and the tumor's direct effect on brain function. As the tumor grows, it can exert pressure on various brain regions responsible for cognitive processes, such as the frontal and temporal lobes. This pressure can disrupt normal neural activity, leading to cognitive difficulties. Additionally, the body's natural circadian rhythms and hormonal fluctuations at night can exacerbate these cognitive symptoms, making brain fog more pronounced during the evening and nighttime hours. Number 7. Memory problems. Memory problems that occur or become more noticeable at night can be a concerning sign, especially when linked to a brain tumor. These memory issues might manifest as difficulty recalling recent events, forgetting important details, or struggling to remember daily tasks and information. At night, these problems can become more apparent as individuals reflect on their day or attempt to organize their thoughts before sleep, leading to frustration and anxiety. The presence of a brain tumor can disrupt memory in various ways. A tumor located in or near the brain regions responsible for memory, such as the hippocampus or temporal lobes, can interfere with normal cognitive processes. The tumor's growth can exert pressure on these areas, disrupting the formation and retrieval of memories. Additionally, increased intracranial pressure caused by the tumor can further impair brain function, exacerbating memory problems. The brain's natural activity during sleep, which is crucial for memory consolidation, can be disrupted by the tumor, leading to more pronounced memory issues at night. Number 8. Weakness or difficulty with coordination. Weakness or difficulty with coordination that becomes noticeable at night can be a troubling sign, particularly when associated with a brain tumor. This might present as a feeling of heaviness or lack of strength in the limbs, making simple tasks such as getting out of bed or moving around difficult. Coordination issues can manifest as clumsiness, stumbling, or an inability to perform precise movements, which can be especially disconcerting when navigating in low light or trying to perform routine activities before sleep. The presence of a brain tumor can lead to these symptoms by affecting the motor areas of the brain or compressing the neural pathways responsible for muscle control and coordination. A tumor in the cerebellum, for instance, can disrupt the fine-tuning of movements, while increased intracranial pressure can affect overall motor function. At night, when the body is more relaxed and fatigue sets in, these symptoms can become more pronounced, making it harder to maintain normal motor functions and coordination. Number 9. Hearing changes. Hearing changes that become noticeable at night can be an unsettling sign, particularly when they are linked to a brain tumor. These changes might include sudden or progressive hearing loss, a persistent ringing in the ears, tinnitus, or other unusual auditory disturbances. In the quiet of the night, when background noise is minimal, these symptoms can become more pronounced and bothersome, making it difficult to fall asleep or stay asleep. The presence of a brain tumor can affect hearing in various ways. Tumors located near the auditory pathways, such as those in the cerebellopontine angle, can exert pressure on the auditory nerves, disrupting the normal transmission of sound signals to the brain. Additionally, increased intracranial pressure caused by the tumor can lead to swelling and further compression of these nerves, exacerbating hearing problems. These effects can be more noticeable at night due to the relative silence, which can make even subtle changes in hearing more apparent. Number 10. Personality or mood changes. Personality or mood changes that become noticeable at night can be an alarming sign, particularly when they are linked to a brain tumor. These changes might include increased irritability, sudden mood swings, depression, anxiety, or an overall change in behavior that is out of character for the individual. During the quiet and introspective hours of the night, these emotional disturbances can become more pronounced, leading to restless nights and an inability to relax or sleep. The presence of a brain tumor can disrupt normal emotional regulation and behavior in several ways. Tumors located in or near the frontal lobes, which are responsible for personality, decision-making, and emotional control, can exert pressure on these areas, leading to significant changes in mood and behavior. Additionally, the stress and anxiety associated with the physical symptoms of a brain tumor, such as headaches or seizures, can further exacerbate emotional disturbances. At night, when distractions are minimal, these changes can become more evident, impacting the individual's ability to unwind and get restful sleep. These symptoms can vary widely based on the tumor's size, location, and type, and they might also be indicative of other medical conditions. If experiencing these symptoms, it's important to seek medical attention for proper diagnosis and treatment. Here are some environmental toxins that may contribute to the development of brain tumors and how to avoid them. Pesticides are chemicals used to kill or control pests in agriculture and residential settings. While they are effective in pest control, many studies have suggested a link between pesticide exposure and an increased risk of brain tumors, such as gliomas and meningiomas. Some pesticides contain carcinogenic substances that can cause DNA mutations, leading to cancerous growths. Examples include organochlorines, organophosphates, and certain herbicides. Additionally, pesticides can disrupt hormonal balances, which may influence the development of cancers. These disruptions can affect cellular processes and lead to tumor growth. Many pesticides are neurotoxic and can damage the nervous system. Chronic exposure to neurotoxic pesticides can lead to neurological damage and increase the risk of brain tumors. Pesticides can also induce oxidative stress, leading to cellular damage and inflammation, which is a known factor in cancer development. To reduce the risk of pesticide exposure, opt for organic foods as organic farming practices do not use synthetic pesticides, and consuming organic produce reduces exposure to harmful chemicals. Washing fruits and vegetables thoroughly can remove pesticide residues from their surface. Use a brush and a mixture of water and baking soda for more effective cleaning. Peeling the skin off fruits and vegetables can also help reduce pesticide intake, though this may remove some nutrients found in the skin. In home gardening, use natural pest control methods such as neem oil, insecticidal soap, or introducing beneficial insects like ladybugs. Avoid chemical pesticides for home use and opt for non-toxic alternatives such as traps or natural repellents. Stay informed about pesticide spraying schedules in your area. Keep windows closed and stay indoors during and after pesticide applications in your neighborhood. Advocate for stricter regulations and the reduction of harmful pesticides, and support policies promoting sustainable and organic farming practices. While pesticides are effective in controlling pests, their potential to increase the risk of brain tumors makes it crucial to minimize exposure. By adopting organic and natural alternatives, practicing thorough cleaning of produce, and supporting safer agricultural practices, individuals can significantly reduce their risk of pesticide-related health issues. Heavy metals such as lead and mercury have been linked to an increased risk of brain tumors due to their toxic effects on the nervous system. Lead, commonly found in old paint, contaminated soil, and certain water pipes, can accumulate in the body over time, causing severe neurological damage. Chronic exposure to lead disrupts normal cellular functions and induces oxidative stress, leading to DNA damage and potentially triggering the development of tumors. Mercury, found in some fish, dental amalgams, and industrial emissions, is another potent neurotoxin. It can cross the blood-brain barrier and accumulate in brain tissue, where it causes cellular and DNA damage, contributing to the risk of tumor formation. To minimize the risk of exposure to heavy metals like lead and mercury, it is essential to take proactive measures. Firstly, ensure that homes built before 1978 are tested for lead-based paint, and if found, professional abatement is necessary to remove the hazard safely. Drinking water should be tested for lead, especially in older homes with lead pipes or solder. Using a water filter certified to remove lead can further reduce exposure. Dietary choices also play a crucial role in minimizing mercury exposure. Avoid consuming high-mercury fish such as shark, swordfish, king mackerel, and tilefish. Instead, opt for fish known to have lower mercury levels, such as salmon, shrimp, and canned light tuna. Pregnant women and young children should be particularly cautious about their fish consumption to avoid potential mercury toxicity. Workplace safety is paramount for individuals in industries where lead and mercury exposure is a risk. Employers should provide appropriate personal protective equipment, PPE, and enforce strict safety protocols to limit exposure. Regular health screenings for workers can help detect early signs of heavy metal poisoning, allowing for timely intervention. For households, it is crucial to avoid products that may contain lead or mercury. Choose lead-free paints and plumbing materials, and be aware of potential lead contamination in imported goods such as toys and ceramics. Proper ventilation and air filtration systems can help reduce the risk of inhaling mercury vapors, particularly in areas near industrial sites. Many industrial chemicals, such as benzene, formaldehyde, and vinyl chloride, are known carcinogens that can damage DNA, disrupt normal cellular functions, and increase the risk of brain tumors. Workers in industries such as chemical manufacturing, plastics, rubber production, and textiles are often exposed to these harmful substances through inhalation, skin contact, or accidental ingestion. Chronic exposure to such chemicals can lead to oxidative stress, inflammation, and genetic mutations, all of which contribute to the development of brain tumors. For individuals living near industrial areas, reducing exposure to harmful chemicals can involve several strategies. Ensuring that homes are well ventilated and using air purifiers can help minimize indoor air pollution. Additionally, residents should be aware of local industrial activities and potential chemical releases, and advocate for strict enforcement of environmental regulations to control emissions from nearby factories. On a broader scale, supporting policies and initiatives that promote the use of safer, non-toxic alternatives in industrial processes can significantly reduce the overall burden of chemical exposure. By adhering to these best practices and advocating for safer industrial practices, both workers and the general population can reduce their exposure to harmful industrial chemicals, thereby decreasing the risk of developing brain tumors and other serious health conditions. We hope that you find this information helpful. Don't forget to like and subscribe if you enjoyed the video.